order, we've got 4 suppliers that are presenting today. So we've got Realise Medical, and then we've got AV Immersives, Aurora Team, and Central. Hope that's the correct pronunciation. So I think, Sonia, you're first up. You could...
Actually, it'll be me, Justin.
I'm right,
presenting on behalf of Realise Medical.
That's fine. So we'll... I'm recording the session. You've got 10 minutes, so we'll allocate 10 minutes. So we'll be finishing at 3 minutes past 3.
Great.
So, yeah.
Thanks. So I have a video. Hopefully it plays reasonably smoothly, but otherwise there'll just be a bunch of interesting images. So my name is Justin Sutherland. I'm the CEO and co-founder of Realise Medical, and we're a medical virtual reality company who are seeking with our product Elucis to enable an era of 3D content creation from medical images for the purposes of pre-procedure planning. So this type of activity has gone on for more than a decade now in the form of 3D printing. And what we're trying to do is make the models that you would typically print easier to come by and then give you an environment with which to interact with them. So this is just some clips of what the platform looks like, but we'll go into how it works in a second. So you can see that in an immersive virtual environment, you have a great deal of flexibility that you wouldn't have had in a physical world or one with 2D screens. The way the platform works is it's a seated experience. So you have virtual reality controllers that you bring in with you along with a desk to become a virtual working environment where you can mark up images to create 3D content. So we'll go into how we've changed the way that we interact with 3D medical images like CT and MRI. You can see here that the image is there as an actual volume, and by intersecting that volume with a viewing plane, which happens to coincide with a physical desk, then what you have is a way to view arbitrary cross sections of the image in an understandable and easily changeable way. You can bring in multiple viewing planes to look at different cross sections. And then whenever you're changing the orientation or position of the image, we provide you with a 3D ghost view of the image to provide some context for those transformations. So you can see that this kind of environment can quickly change the way that we look at things. Instead of being a slice by slice modality, we can do it in a much more flexible way. So then getting into the core of the content creation of the platform, we basically perform an activity that is typically called segmentation, although there are some differences in terms of how we do it, but it's mostly what it is. Using a virtual reality controller or a VR stylus, you can mark up an image on the surface or in air. At each point, this is the same activity. And with some thresholds applied, you can quickly generate 3D models or structures from the anatomy in that particular image. So this is an example of creating a colon from a CT colonography quickly by just drawing on the image. This is an example of a kidney with some tumors in it and the ureter. So this is a content creation platform that would be replacing often what was done on a 2D screen. And we liken it to putting a sculptor back in front of their sculpture when before they were taken away and given a keyboard and a mouse. So with a number of easily understandable and simple tools, we've made what can typically be a tedious process into one that's very quick. And you can imagine that having the 3D content in front of you as you're generating it makes it much easier to understand and disambiguate the various details in the image. We have tools for changing the bright color and resolution and the transparency of the images as well. And then, of course, with these types of modeling activities, there's typically Boolean operations or things done like shells to put around structures so that you can quickly, from the image that you've made, create these detailed structures. Here's an example of a movable clipping plane that can be permanently applied to the image. So this is a type of activity that was done laboriously for 3D printing in the past. We've endeavored to have a really robust application. So to that end, there's also a desktop user interface that's connected. And this is what you use to generate new projects by importing images. You can also navigate the scene in 2D as you would like a video game, access all sorts of settings like changing the dominant hand that you use. And then we also give users the conventional views that they would have for images so they can scroll through and see things in a conventionally understandable way. We also have a number of pieces of learning content, such as tutorials that are interactive that you can load. So we take you through step by step. Of course, some people might have their own platforms that they are used to using for generating 3D models. And so you can import those models into our platform for pre-procedure planning purposes or for research or education. So these models can be imported into using a number of different formats. And then they're quickly brought in. But the great thing is that they become an editable structure as if they were created within the platform from scratch. So you can bring in anything, but then start editing it just like you would a structure that you created from the image. Any of the structures that you import or create can be unlocked from the image and become grabbable and resizable. And obviously, this leads to a number of different ways you can interact with the content that you've quickly created. So here we just made a fun example of a brain tumor that is taken out of the skull. Of course, creating content is not the only thing that we want to achieve. So we implemented a number of communication tools, one of which is a few forms of measurement that can be quickly done. We also have a 3D markup or sketch feature where you can mark up images and save those for downstream recipients. We also have an interesting feature where people can mark or draw on the 2D representation of the image, and then the VR user will actually see their cursor. So you can have these synchronous communication modes between desktop users and VR users. Additionally, to enable 3D content creation and planning purposes, we have voice memos that can be placed in 3D space. And so by placing these, you can record a message to someone who will be looking at it later, and then they can go back and play that message. These things can also be generated from the 2D views on the desktop as well. The thing that we're most excited with this platform is remote collaboration. And so the platform is fully integrated over the internet so that you can connect with a remote user and you can generate content from the images on the fly with that user. You can discuss the content that you've already created. You could teach trainees or consult with someone who is an expert in your field that is a great distance away. And you can see how this type of collaboration can really create these fluid and dynamic environments where you're discussing things with other users. So here's an example of discussing something of a feature of the colon. The nice thing about this is if you're dealing with an intra-institutional collaboration, so people in the same institution, you can connect with just a single click. But if you wanted to connect with someone who's outside of your institution, we give the option to export a project and anonymize it on export. That person simply imports the project on their own end, and then you can connect with a secure one-time key that's generated with a single click. So you give them the project to share, and then you give them that key, and then you guys can connect. And the nice thing about this is that we never transmit any telemetry that has patient health identifying information. We leave that up to the user how they want to share that information. So that's an overview of our platform. Hopefully you found it interesting. And if you have any further questions, obviously I'm here for questions, but you can look up more on our website, realizemed.com. realizemed.com Elucis talks specifically about the platform, and if you want a free demo to try, you can download that from /demo.
That's great, Justin. Thanks for that. Has anyone got any questions? Because I've got a minute left. If anyone's got any questions, or we'll move on to Keith. Okay, that's great. Thanks, Justin.
Thank you very much.
Are you ready, Keith, to run through your 10 minutes?
Sure, yeah. I just need to launch the presentation, which I've uploaded. Can you see that?
Yeah, I can see PowerPoint, yeah.
Is it next generation training simulators, I should say?
Yeah, that's it.
I've not done this Microsoft Teams presentation, so thanks for the invitation to participate in this event. My name is Keith Myers. I am the Creative Director of AV Immerse. I think the slide said immersive, and there's some different interpretations of what that is. Like there is with immersive technologies, there's still quite a lot of interpretations around what the different terminologies are. However, I'm here today to talk to you about I thought the last presentation was, the first presentation was great, by the way. But it was a very interesting way of using medical technology. And I suppose in contrast to that, this is using more film techniques, but using a game engine technology to create experiences. And I'll show you what I mean by that. But the project I'm going to talk about is the next generation of training simulators specifically aimed at antimicrobial resistance training. I'm not a medical professional myself or a GP, so I'm not going to go too deep into that subject, but AMR, the acronym, stands for antimicrobial resistance. And what that essentially comes down to is the way that microbes react to medicine, or from my understanding, is antibiotics. So if you give your entire population, everyone, penicillin when they've got ill, and what happens over a period of time is that the microbes will gain a resistance to that particular rendition of that penicillin, which is why there is a lot of iteration in the medical industry in terms of the new drugs that come out. So there's always a little variance in terms of what's produced, because the microbes change over a period of time, specifically if we're administrating these drugs to the population and we're not doing it in a concise and careful way, then that can lead to the drugs that you're giving people basically not working or not being as effective. So there's a big drive in the NICE guidelines from the NHS sector that we've been working with to try and use or create a new training method to teach GPs, essentially. So the purpose was to deliver training to GPs, to deploy specific training scenarios and develop analytical tools for measuring responses. And then what we've done from that is gathered that user feedback, and we're iterating now on the new versions of that training. The way we approached the project is that we actually used a game design methodology. So using traditional game design approaches, so thinking about the user interface and how the user interacts with that actual experience. We actually designed the experience based upon the fundamentals of what it is we're trying to achieve. So we went along the route of a gamified experience, and we worked with subject matter experts to create the scripted scenarios. And we actually worked with a lot of senior GPs within the Merseyside region to create this training simulator. So those, I guess, were the trained medical experts, and we were the people that were putting together the experience itself. But that's kind of the approach we took with this. So we also work with a number of actors, and we blended, just going back to the beginning of the presentation, blending traditional visual representation. So we actually use a lot of 360 camera technology, stereoscopic technology, and that's what we use to build the experience. But we also use the game engine to allow us to create those interaction points. And what it allowed us to do is to gauge the feedback from the participants in the pilot, and we created a scorecard to track the progress as well. And if the video plays, I'll show you. This is a small sample. The volume might not work because I didn't press the magic button at the beginning, I believe. You might be able to hear the volume, you might not. But essentially, what we're doing, the way we've actually made the experience, is using games engine technology and creating user interfaces and allowing the user to create their own journey. And like I say, it's a gamified approach to experience creation. And then what's happening is that the user is essentially participating in a scenario that we film with actors, and then based upon what they witness, they can then choose the correct course of action. So this is the gamified thing, if you like. And then based upon what the user chooses, will then determine if they've been correct or incorrect, and they will get user feedback from that. So that's the latest pilot we've been doing. A few years ago, working in the same region, was also creating emergency training room simulators, again using 360 camera capture techniques and putting the viewer inside the actual experience. So both of these experience was the end aim was to create a VR experience you could actually witness inside a virtual reality headset. we're seeing more adoption of these headsets of late, particularly the price point of VR headsets coming down with the Quest 2 now. So this gives us an opportunity to have a case for utilising this technology. Before, just a few years ago, the price of a headset was astronomical compared to what it is now. So, like I say, it's been piloted in the Merseyside region at the moment. We've encountered a few issues with the COVID-19 situation. Sorry to bring that up. It's a sore subject, but this has been a real issue that we've been trying to navigate as well, because obviously everyone's frightened of passing on the virus by touching objects. So fortunately, the way we pivoted this particular project, the antimicrobial resistance training, is that we actually made it for online distribution and inside a headset as well. So with that, we were able to deploy a two-pronged approach rather. And this really sums up the last few works we've been, last few years rather, the work we've been doing in the Merseyside region. And just to reiterate some of the points that I've mentioned, it's offering an alternative to traditional media training. So we're trying to approach these scenario creations with not all the CGI necessarily, but we're actually blending the film world. So when you put the headset on, you can actually still be in the space, but feel like that you're participating in an experience. Some of the scenarios that we created, we were embodying a GP, so you actually feel like what it is to be like in their shoes. Alternatively, we would just put the camera in the scene and allow it to play out, so you can actually observe the scene. So it's really to train the next generation GPs to see what's happening in a real world scenario. And because you've got the headset on, you're actually inside that situation yourself. And like I said, we've produced two outputs for this, the traditional 2D interactive training and the VR headset. And we know that there's still barriers for adoption of this technology, but these kind of events that we're here today to talk about this technology, and I think the keynote, the openings, the doctor that was it Dr. Shah, I think, that gave the opening sort of theme to this event was really interesting, because he was touching on a lot of other technologies like AI and volumetric capture techniques as well. So I think it's a real golden opportunity for this technology, and hopefully COVID is resolved next year maybe, and then we can move forward and more of these type of experiences. And that's it really. I thought I'd pause here just to answer any questions that anyone might have. My contact details on the form.
That was really good, Keith. Really insightful in terms of your project and your practical application of it. I think that's definitely struck a chord. Yeah, if there's any questions for Keith, we've got a spare minute. Or
could I ask you a quick question, if that's okay?
Mm-hmm.
Sure.
Hi, yeah, my name's Cameron Clark. I'm calling from Hull Road Infirmary as a technician. We've kind of done a couple of these 360 videos in the past, but it's just kind of like a non-interactive tour. I really like the idea of your platform. Just one quick question that I had was, is the videos only compatible on headsets, or could this be implied into like other browser platforms as well?
In answer to your question, both of those, we've made it so that you can actually interact in the headset, but also we've created interactive video as well. So it doesn't necessarily just have to be in the headset.
Oh, perfect. Thank you. Yeah, it's just because of the pandemic, that was all. I know people are a bit iffy with putting headsets on and that. So, no, finding out that there is an alternative to headsets as well is a good idea. So, yeah, thank you for that.
No problem, Cameron. It's a valid point for everyone here in this room that the pandemic and people are scared of touching objects like this now because what's been going on. So I think a lot of people have switched to online distribution now as a viable method, really.
Right, that's great. Thanks, Keith. So next up, we've got Sandra. You're on the.
Hi.
Hi, Sandra.
So let me share my screen. quickly. Okay, I guess now you should all see it.
Yeah.
Very well. My name is Sandra. I'm calling from Switzerland. We are a project called Aurora from the ETH Zurich. And for the beginning, I'd like to show you a video. I hope it will be actually playing.
The first
And I hope you
impression
can
for
hear the
me
sound.
when I used the Aurora app was Welcome to the Future.
Up to now, everyone is dealing with two different worlds. We have a digital world, we can perceive information from computers, from display, and we do things in the real world, and this were separate. And with the AI technology, like with the HoloLens 2, these two fields are really converging. So an operator or a user can see the real world and the digital information at the same time. This is especially important for training purpose, for guiding purpose, getting information without being distracted from your field of application.
This innovation tool will help us to help patients and to treat them better. I mean, we have to educate and teach a lot of people, young doctors, young perfusionists. The big advantage of the HoloLens is that you do not need the trainer next to you. I mean, you can use the HoloLens, do training by yourself, and you are able to get feedback directly from the app. It's a fantastic innovation, and I think there's a big need, especially in the university hospitals all over the world.
We did a lot of testing with surgeons and cardiac technicians from the university hospital to ensure that our medical input is correct in our application, and the surgeons themselves can actually use our application and it is intuitive to them.
From my knowledge, it's one of the first and really complete medical IR demonstrations where the technology can really add value. I think the future will be that also surgeons will have this kind of assisted technologies to advise in critical situations.
So, like for the scenario, imagine you're a surgeon and you have to perform a complex procedure which has many steps, and almost always there are any complications, and you have only performed this intervention twice in your lifetime, but the last time was 6 months ago, and at your hospital there are no training possibilities. And are you really ready to perform in this situation on a real life patient? And that's a situation we ask ourselves, and we thought it should never happen again to any surgeon or any surgeon in training. But still, at the moment, for surgeons who work in the field of cardiac surgery, or more precise in the field of ECMO implantations, it can be a real life scenario. And they have to perform quite well without even a lot of training, as there are not much simulators, and the simulators are very expensive. And for your understanding, ECMO implantations, ECMO is short for extracorporeal membrane oxygenation, and it's a device that will support the heart and lung function of a patient, or even take over the complete heart and lung function. And teamwork is needed for the intervention. There will be a surgeon which has to perform the cannulation on the patient side. These are quite long cannulas which reach from the artery to the heart area of the patient. And if not performed correctly, there can be done a lot of damage. And on the other hand, there is a perfusionist who will look for the medical device and tune the parameters so that the function of the heart or the lung can be supported quite well. But at the moment, as already told, there are not a lot of simulation and training possibilities, and experts are rare in this field. So we thought about introducing new technologies, or more precise, augmented reality, in the form of the Microsoft HoloLens 2 into this field. And therefore, our project exists. We are Aurora, a focus project of the ETH Zurich, and we collaborated with the university hospital to ensure that we can create an augmented reality operating room assistant. It is our vision as a team to simplify training opportunities and to make new opportunities for surgeons to train, not on a patient itself, but in a simulation. This training should be self-guided without additional supervisor needed, and there should be feedback after each training session. Additionally, we want also to support the surgeons during the preparations for intervention. As for example, here in the picture, you can see the selection of the tools and even the selection of the tools in the right order, and we can correct it and supervise it. Last but not least, we want to optimize the troubleshooting, as ECMO patients have a lot of complications, and there is a need for a standardized troubleshooting scenario and a standardized guide which helps knowing which problems can occur and how to solve them. And we have created an application which is on the Microsoft HoloLens 2 and has two main parts. The first part is a standard operating procedure, short SOP, and it is a step-by-step guide which will enable surgeons to train the act of cannulation on their own. Secondly, we have created a troubleshooting guide, short TSG, which will then be a guidance system for any complications and which helps the surgeons or also the ICU nurses to solve any problems with an ECMO patient. For the standard operating procedure, we introduced computer vision, as you can see on this small video. I hope it works. Here you can actually check the tools, whether you've selected the right ones and in the right order, especially when you're new in this field. You might not know if you need a clamp or a scissor or any other tool at the moment, so there is assistance for that. And additionally, there is visual guidance in form of videos, images, and text, which will explain every step very carefully, and you can rewatch it. You can try it yourself on a simulator. As you can see here on the video, there's a simulator in front of the operator, and you even get feedback after each training session. There is an evaluation algorithm which will tell you how well you've performed, and you can record your session and watch it later on or actually discuss it with an expert in the field. On the other hand, the troubleshooting guide, there we also implemented visual guidance, but with a 3D animation, as you can see here, especially on the ECMO device itself. There are a lot of buttons, there are different functions. ICU nurses do not know this device very well, especially in smaller hospitals. They only have ECMO cases once or twice a year. And with our troubleshooting guides, they get the information they need so they can start any troubleshooting when a complication occurs. And they also have possibilities which cause it might be. They can conclude it either on their knowledge, or we also implemented data tracking where we track all vital parameters of the patient and do a pre-selection of the complication or the possible causes. And we have a warning system which will alert them whenever something does not seem to be right. So that's us. We are actually quite new. We started a bit more than a year ago, and we're very excited to present our project here. And if you have any questions, we're delighted to answer them.
That's great, Sandra. Thanks for that interesting presentation, the interesting user case and application of it. We have got a minute, so if anyone does have any questions for Sandra, we could field them, or we can move on to the next presenter.
I just had a quick question. My name's Sophie Castle-Clark from Eastern AHSN, and I just wondered whether you'd be looking to develop this in other areas, or whether you're just focusing on ECMO for the foreseeable future.
We actually just started on ECMO devices as we had experts in this field. It is implemented so that it can be transferred to any kind of intervention which is in a step-by-step guidance system. We have not yet planned actually a project for another tool, device, or intervention, but we will see what the future brings.
Great, thank you.
That's great. Thanks, Sandra. And our final presenter, which I think is Tom. Are you there, Tom?
I am. So I don't know if you can see that. You can see the presentation okay?
Yeah, we can see it. Yeah, that's great.
Okay. So I feel quite intimidated, actually, because we're not a specialist medical solutions company. We develop virtual reality and augmented reality training solutions for business and for some medical solutions, but mostly for business. We were approached by a consultant ophthalmologist who kind of identified a number of different problems. Okay, where do I? There you go. Who basically identified a problem, and that was that the students that he was teaching in one of the teaching hospitals in Belfast basically just couldn't get experience. They were turning up at clinics, and it was almost potluck whether or not they could see the conditions that they were being taught. And oftentimes they were seeing multiples of exactly the same conditions, so common conditions, and that the rarer ones are the more I don't know what you would say, the more important ones, if you like, that are slightly rarer. They just weren't seeing. And so he wanted a solution that allowed us to simulate an examination of a patient. So I'll play the video and it'll kind of walk you through the process. I think I have the sound turned off. So this simulates everything from the practitioner coming into the examination room, making sure the lighting's okay, sanitizing, and then carrying out an eye examination. And it probably doesn't do it justice here, but everything is medically correct, as we'd expect. And the student carry out the examination, doing a series of different things with a torch or the pencil or whatever. It means they can make mistakes. It's going to be asked in a second. They'll turn around to the computer and kind of diagnose and give their opinion on what was wrong. So they end the assessment. It's asked a number of different questions. And they can be asked to make a diagnosis. And so this is all, obviously with the current situation with COVID, it means that a student can practice as many times as they want, practice different conditions as many times as they want without any need for test subjects or the public and all the expense that goes with that. There you go, so that's the examination finished. So our plans are in the next quarter to release a teaching version of this as well. So currently what we have is what you've seen, which is a full simulation of the actual examination. What you didn't see was before the person goes into that room, they get to select from a number of different conditions. So that's really a practice application. What the teaching module will allow is an external control from a smartphone. Where an actual teacher or an assessor can select the condition, and the student goes in and has to carry out that examination without knowing what it is, obviously, and that allows them to record all the scores. And we're just about to put this into one of the major teaching hospitals in Belfast. So that's it. If anyone's any questions, I'm happy to answer them. My contact details are there as well.
Thanks, Tom. That's really good. Again, a good application of the technology, and like you say, interesting that you're not necessarily in the healthcare market, but being contacted by a clinician or whatever who saw that opportunity. So that's really interesting. Has anyone got any questions for Tom? Or we'll obviously circulate contact details. We've got the recording as well, which we'll be able to share as well. And if you need to call out to any of these suppliers with their products, whatever you can do through our contact details or directly to them. So yeah, we've got finished slightly early, so let's use that opportunity to either go and get a drink or nip to the loo. Joining back at the main auditorium, it's just following the same link back to it, so you shouldn't have any problems getting back there. And the recommence starting at 3:40.
Have you got a link to that, Sim, by any chance? Can you put it in the chat?
Yes, I will.
If you don't mind. I didn't have a link to that before.
Yeah, I've been told that you should just be able to leave and go to the other one, but I will put the link in now.
Thanks.
The link's in there. So, okay, good to demonstrate these products, and hopefully I'll speak to you later. Thanks a lot.